Welcome everybody to this year's annual PSEDM convention entitled Hope, Health Optimization, and Progress in Endocrinology. I am Dr. Michael Lim Drillia. I am your scientific chair for this year's convention. And this will be PSEDM's first virtual convention, and I promise you we have made a program that you will truly enjoy. We have invited well-renowned international and local speakers who will expound on the different topics that we have prepared for this 3-day annual convention. I assure you that they will be discussing to you from basic research to clinical application in this annual convention. It starts on March 17 as a pre-convention, and we have two important programs for that day. The first is the pre-convention on the utilization of your CGMS, your continuous glucose monitoring device, and in the afternoon, the clinical aspect of the utility of the insulin pump therapy. And another program for that day will be on learning the clinical aspects of ultrasound-guided biopsy. During this program, we have lined up more than 7 speakers who will be discussing the basics on the utility of ultrasound, its clinical application, and there will be a practicum on a later date. The annual convention will start off on March 18, Thursday, and we have chosen 1 p.m. to open our annual convention. The invocation will be, of course, by our very own Secretary, Dr. Carol Narvacan, and the welcome remarks by our President and overall Chair, Dr. Jeremy Jones Robles. And the opening remarks will be given by no other than our PCP President, Dr. Mario Panaligan. And to start the annual convention, our very first speaker will be given by no other than our beloved Dr. Augusto Litonwa, who will be discussing to you a very important topic, 100 years of insulin, a discovery that changed the world. And Dr. Litonwa will give us that full view on how insulin has changed the lives of our diabetic patients. The second lecture will be given by Dr. Robert Bigurski, and we will be talking to you about time for change in assessing glucose control. So he will be discussing to you the different measurements of glycemic control, measuring HbA1c and comparing it to the utility of time in range. In the afternoon, there will be discussions from the different pharmaceutical friends during the snack symposium, and then eventually move forward to different concurrent symposia. And we have 3 concurrent symposia. One is track on the thyroid. The second track will be on reproductive endocrinology. And the third track will be on metabolic disorders. For the thyroid track, the very first topic will be discussed by Dr. Bilacura, who will be discussing on managing cardiovascular effects of thyroid dysfunction, followed by our speaker, Dr. Bunagan, who is an ophthalmologist, and will be discussing to you now advances in the treatment of thyroid eye disease. And the third lecture for that afternoon will be given by Dr. Nemencio Nicodemus, who will talk about the spectrum of autoimmune thyroid disorders. The last lecture for that day will be given by Dr. Elizabeth Paz Pacheco, who will be discussing to you molecular genetics of thyroid cancer, implications for diagnosis, treatment, and prognosis. For the second track on reproductive endocrinology, it starts off with a lecture given by Dr. Amy and Doug Silva, who will be discussing to you some case management on how to approach patients with gynecomastia and hirsutism. This is followed by the case discussion on medical and surgical treatment of infertility. This will be given by Dr. Dennis Dusaya. And third, also a case management And this will be a topic on anabolic steroids in sports. What we know now, there are a rising number of patients who are abusing anabolic steroids to enhance performance. And this will be discussed to you by Dr. J.M. Ko. And for the last speaker for the track, we have a favorite lecturer, Dr. Delphine Tan, who will be discussing to you surviving perimenopause from research to practice. For the third track, we will have the metabolic disorder, and the lecturer for that track will be no other than Dr. Ruby Go, who will be discussing to you management of diabetic dyslipidemia beyond LDL. The second lecture for the track will be peculiarities in the lipid treatment among Filipinos and Asians. And the third will be mealtime strategies for weight loss and diabetes. Should we eat by the clock? And this will be given by Dr. Joy Fontanilla. And the fourth lecture for the track is on severe hypertriglyceridemia in pregnancy, given by Dr. Rosa Allen C. At 5:30, we will have our third plenary lecture given by Dr. Vivian Lim from Singapore, who will be discussing to you important aspects on calcium and vitamin D in bone health and sarcopenia. And in the evening, there will be a dinner symposia, and we have four dinner symposia for that evening before we close at 6:45 in the evening. The next day will be on Friday, March 19. We will start again the annual convention at 1 to 2 p.m. However, this will be opened with a lunch symposia, which will be industry sponsored. We have also 4 tracks for that. And we start the annual convention proper at 2 p.m., which Dr. Cecilia Jimeno will be given a topic on oral agents for type 1 diabetes mellitus. And the second plenary lecture for that day will be given by Dr. Hu Yip from Australia, who will be updating us on testosterone use and cardiovascular risk in older males. In the afternoon, we will divide into 3 tracks. The first track will be on diabetes, the second track will be on general endocrinology, and the third track will be on obesity and nutrition. The first lecture on the diabetes track will be given by Dr. Joseph Adrian Buensalido on managing diabetes-related infections of the lung and feet. The second lecture will be on advances in diabetes technology. Will it change clinical outcome? Given by Dr. Mitos Cabral. The third lecture will be on updates in diabetes retinopathy, given by Dr. Marie Joanne Loy, who's an ophthalmology. And the fourth track will be given by Dr. Suzette Kiawit Alegarbes, who will talk about the facts about insulin plants, botanicals, natural herbs for diabetes. Quite an interesting topic. On the second track, on general endocrinology, we will be discussing on clinical person in hypercalcemia, which will be given by Dr. Mark Anthony Sandoval. The second lecture will be on clinical pros in hypocalcemia, given by Dr. Schoberg Ko. The third is on clinical pros in metabolic bone disease in chronic kidney disease, given by Dr. V. Marluz. And the fourth lecture for that day will be on catecholamines and COVID, given by Dr. Lailani Mercado Asis. The third track on obesity and nutrition will be on the first topic will be on diet versus exercise, the facts about weight loss. Our speaker for that lecture will be Dr. Mia Pojas, who is our immediate past president. The second lecture on for the track is on evidence-based exercise, the health benefits and risks of physical activity and home-based exercises and fitness, given by Dr. Frederick Cheng. And the third topic will be on step counting device-based intervention for weight loss, given by Dr. Jimmy Aragon. And the fourth lecture for that day will be managing nutrition for gestational diabetes. And in the evening, we will have our dinner symposium, which are industry sponsored. We will have 4 tracks for that time slot from 6 to 6:45. Our last day will be day 3 on March 20, which is a Saturday. Our convention will open up with a lunch info. We will have 4 tracks there. And for the annual proper, we will start at 2 p.m. And our first plenary for that day will be given by Dr. Bart Clark, who is an American but Filipino at heart. We will be talking about diabetes and bone health. The second lecture will be on polycystic ovarian syndrome, an update given by Dr. Bullen Yildiz. We will have a break. We will have a snack simple. We will have 4 tracks for that snack simple, and then eventually go back to our annual convention proper into 3 tracks at 4 p.m. And for that 4 p.m., we have a pediatric endocrinology and novel therapy track. And the second track for that day will be on diabetes. And the third track will be on challenges of general endocrinology. And on the first lecture for the first track on pediatric endocrinology and novel therapies, we will have a very interesting topic, the promise of pancreatic transplantation by Dr. Sigfredo Paloyo. And the second lecture for that day will be on screening and management of endocrine disorders in children with special needs by Dr. Eleanor Du. And the third lecture will be on hormone replacement for hypopituitarism in the young, given by Dr. Susan Campos. For the second track on diabetes, we will discuss to you updates on vaccination practices for adults with diabetes, given by our PCT president, Dr. Mario Panaligan. The second lecture for that day will be on inpatient diabetes management of COVID patients given by Dr. Roberto Mirasol. And the third lecture on this track will be about telediabetes, trends in outpatient care delivery during COVID pandemic. I promise you that this will be a very interesting topic given by Dr. Iris Isitan. And for the last track, challenges in endocrinology, the first lecture will be on management of growth hormone disorders given by Dr. Rowena Ejercito de Jesus. And the second lecture on the track will be on management of giant prolactinoma. Our speaker will be Pesha Maningat Goko. And the third lecture will be on approach to patients with adrenal insufficiency by Dr. Gorgonia Panilagaw. And our last plenary lecture will be given by Dr. Margaret Weirman, and she will talk about hormone replacement after pituitary surgery. Towards the evening, we will have some closing ceremonies and giving awards for research and certificates of appreciation and awarding of raffle prizes. And at 7 p.m., we will have the PSEDM business meeting, and this will shortly be followed by a fellowship night. So as you can see, we have prepared for you a stellar list of doctors who will expound on the different topics, and we have created a very interesting topic for you that will discuss to you an array of endocrine concerns. With that, I hope you sit back, enjoy, and stay on and listen to all the programs and finish this annual convention. Thank you very much. Stay safe. Have a nice day.